Dr. Kaneganti, it is well known and a great concern that diabetes affect the heart. And we know that is one of the leading causes of death, heart attacks and heart complications. How, as a cardiologist, could you describe how poorly controlled diabetes affect the heart?
Diabetes tends to affect every single organ of the body. When it comes to its impact on the cardiovascular system, it tends to damage by damaging the arteries. So if you see this is the artery, the inner lining, so constant high blood sugar levels, they tend to damage the inner lining of the artery and damage this vascular smooth muscle, increase the levels of inflammatory mediators like tumor necrosis factor, cytokines, and reactive oxygen species, free radicals. All those enhance the process of cholesterol deposition and plaque buildup. These obstructions, these are the ones which affect the organs which those arteries supply. So if these changes occur in minute, teeny tiny arteries of the kidney, causes nephropathy. If it affects the eye, we see retinopathy. If it affects the arteries, the branches which are going to the nerves, it can cause neuropathy. Similar thing if it happens in a much bigger arteries, like heart arteries, brain arteries can cause heart attacks and strokes. And if you look at the nature of plaque morphology, that means the plaque is right here. Between a diabetic patient and a non-diabetic patient, the plaque is more vulnerable to rupture. So plaque rupture, that means with the blood pressure changes or with any chemical changes or stress, the plaque can get lifted up, immediately a big blood clot forms. That's how heart attacks and strokes happen. So this vulnerability of the plaque rupture is very high in diabetics. On top of it, every person has a natural body's defense mechanism. When there is plaque rupture, our body tends to patch it up a little bit, and whatever little clots are there, it tends to melt them out. These defense mechanisms are much poorer in diabetics compared to non-diabetics. That's why it's very important to control the diabetes, blood sugar levels especially. And it affects, because the blockages, it causes stiffening of the arteries, can cause increased blood pressure, heart attacks, congestive heart failure, abnormal heart rhythms, etc.